Hi everyone, and welcome to the 35th episode of Battles and Voices. I'm Latika and I'm the founder and host. Battles and Voices brings together people involved in healthcare across the world in order to build a supportive community for the next generation of medicine. Please welcome our guest, Mrs. Zaba. Thank you so much for being a part of this episode. It truly means a lot to us that you have joined us today on Battles and Voices. Feel free to introduce yourself and share a little bit about who you are.
Okay, so thank you very much for this opportunity. As she has rightly said, I am Miss Ogochukwu Azagba. I'm a nurse midwife who has practiced for over 3 years. I'm also a medical virtual assistant because of my aspirations towards leadership and putting in structures into places. And yes, this is just the few little things I have to say about myself, aside from the fact that I have encountered a lot of leadership aspects of life and especially industry as a whole. So yes, that's a little about me.
That's wonderful. So, moving into our very first question, can you tell us a little bit about what kind of inspired you to go into healthcare and, of course, what you do currently?
Okay, so basically what inspired me to go into health, the little joy you get from taking care of people and then after they are made to get well. And whereas some of them don't have the opportunity to, live on for longer years, but having known that you were there for them when they needed, one of the aspects of a nurse is, having to be an emotional support to people who are undergoing certain conditions, knowing that at the end of the day, they remember that yes, this person was there for me, this nurse was there for me, showed what it means to be a nurse and a healthcare staff. And right now, I'm a nurse midwife, and I'm also into um, medical, the virtual assistant industry, as well as women empowerment and leadership in different spheres as a whole. So yes, that's a little of what I'm into right now.
Perfect. So what motivated your interest in leadership and administrative healthcare?
Okay, so pertaining to leadership, I love seeing that things are brought into action. I love seeing structures being put into place, from bringing little ideas here and there, and then one structure. It just makes things look so beautiful. And then my administrative healthcare sector, for the healthcare industry we have now, everything starts from the top chain where we have the leadership. There are a lot of changes that are made down the chain of leadership or down the hierarchy of leadership is because the leaders at the top were doing what they were supposed to do. And that is why I love the administrative healthcare because you get to put certain things into action. A lot of places where you see that there are loopholes and there are gaps. When you're in the administrative aspect of healthcare, you would find out that you're able to make corrections to those aspects of change and all of that. So that's my reason.
I really love that. And I liked how you kind of showed your leadership work and how you put that into action. I really love that. So what motivates you every day to keep going in such a demanding field?
Okay, so indeed, it is a very demanding field, especially the hours you have to put into work. And if you're on duty, you work in an emergency case, it's a lot. But whenever you look down on humanity and look at how people get better, people systems are becoming different, things are changing, it motivates you to put in a little here or there to make so much difference, as you would say. So I would say what motivates me to keep going is results. If you keep on doing something, you're not seeing results, definitely you're going to have, less hope in that area. But then when you're doing something and then you're seeing results, and then there is a change, it motivates you to do better. Or most of the times, if at all there isn't a change, it motivates you to create other avenues to make more results come up. So yes, that is my take.
I really love how you said that when you pursue leadership, you have so many different avenues. And I think that's really important to keep going in such a demanding field. So one of your key interests is respectful mentoral care. Can you tell us more about why this topic is important to you?
Okay, so as a trend in the world right now, we are trying to, in every aspect of every industry, give women a headway. And when I was talking about my introduction, I said I love women empowerment. And another way of empowerment is by giving adequate health care, basically. So, in terms of respectful maternal care, the reason why I love that topic is because it has to do with empowering women who are going through or who are pregnant and getting ready to give birth. Because we have had research, and I'm currently conducting a research that has to do with this particular topic. And the reason why in some healthcare systems we have a lot of are having certain issues during labor, where you have the healthcare staff not being respectful enough during this procedure. And whereas the healthcare staff have their own excuses, I do not feel that it is enough to do such. And this is a period where this patient needs you the most, because this is a time to give adequate emotional support, and then we have otherwise. So that is the reason. Empowering women in the healthcare through the healthcare industry. Because when you have women who have sound health, who can give birth properly, you have a better society at large. Because it's the women who bring the larger population into the world, basically.
Yes, I really agree with you. I think women's empowerment is such an important aspect nowadays. And congratulations on your research as well. Could you tell our viewers a little bit about what you're conducting research on and a little bit about what you do for the research?
Okay, so basically, I am conducting this research um, within the nursing population. That is, I am interviewing midwives to know the
Mm-hmm.
reason why in some healthcare society we have disrespectful maternity care or maternal care instead of a respectful maternal care. So it involves me going to different hospitals within certain locations or vicinities and asking nurses, why do you think this goes on? Is it because you feel like, oh, if you don't speak to the woman this way, the labor isn't going to go properly? So those are the little details about the research I would go about, and then the research at the end of the day is going to give the healthcare industry at a large an idea of why nurses act this way, and a way to combat this in the healthcare industry? Is it going to be more training for the nurses? Is it going to be more facilities? Is it going to be calling non-governmental organizations to help facilitate all these processes? So that's what the research is basically about.
That's amazing. I really love that. So what achievement are you most proud of so far in your career?
I think it was being given the opportunity to be a president of a non-governmental organization, which was basically under the industry of nursing, as I would say, for healthcare, because it gave me a chance to actually take things, into action. Sometimes we always say that it's not enough for you to just speak and point out what is wrong. but what are you doing to ensure that those things that are wrong are fixed? So this was a great opportunity for me to do that, to put into structure so many things that could better the nursing industry at large, giving ideas and all of that. So I would say that is that. And then my second achievement, once I'm done, would be the research, which I'm currently, you know, getting into collecting data for. So yes,
Congratulations again. Yeah,
thank you
you
so
are
much.
doing amazing work in your community, and we love to see that. So, moving on to goals in the future, what are you currently hoping to do next, maybe in the next 5 or 10 years?
I feel like I would still be in the women empowerment industry because there is a lot of things to be done aside from healthcare. I mean, in a general, way, I would
Mhm.
love to continue that aspect to go into women leadership. Inspire young ladies about leadership, inspire young ladies about themselves, feminine care, and all of that. So that's where I look forward to being in the next 10 years.
That's wonderful. And our last question is, do you have any advice for students, young women, or even young professionals who want to enter healthcare or even healthcare leadership like you?
I think my first, advice or, what you would call it is to really study and put your mind down to that because when you want to make a change in society you actually have to be knowledgeable in what you're doing. You can't step into places, you cannot step into offices if you do not know what you're doing. And
Mhm.
just keep focused because there are different aspects to the healthcare industry. It's so vast, and then you can make a change in whichever aspect of the industry you decide to go into. But you have to study, you have to become approved, you have to become good so that when questions you would be able to answer, you would be able to give valid points. We have so many people who have come up with so many things these days because they studied and they were able to think, well, to make a change in the world. That's why we have vaccines. We have so many things coming up
Mhm.
these days. And that is because we have people who studied and were dedicated to, this line of work. So that is why, that is my advice. They should keep it going, and indeed, they would make a mark. They would make a change, as far as they are ready to study.
Yes, education is really important. So thank you, Miss Azaba, for sharing your journey, your leadership experiences, and your passion for respectful maternal care with us. It was incredibly inspiring to hear the impact that you've made and you will make, and the change that you continue to work towards your research. To everyone tuning in, thank you so much for joining us on this episode of Battles and Voices. Your support truly means the world to us. If you enjoy this conversation, be sure to follow, share, and stay tuned for more episodes of Battles and Voices. We'll see you next time.